Hello everyone, my name is Dr. Sanket Pisar. I am a gynecological endoscopic surgeon practicing in Mumbai, India. And today we are going to be discussing an important topic, which is the non surgical and non hormonal treatment of a very common condition that women suffer from, which is polycystic ovaries. In order to understand what this natural treatment of polycystic ovaries is, let us in short understand what exactly is the problem with polycystic ovaries. In polycystic ovaries, most women have an imbalance of those hormones that cause regular cycles in their body. These hormones are called the follicle secreting hormone, FSH, the follicle stimulating hormone, and the luteinizing hormone, which is LH. So it is an imbalance between these two hormones in the body, which basically causes the problem of polycystic ovaries. Every month in a natural cycle in a lady, there is maturation of one single oocyte which forms into the ovum, and the ovum then ruptures at the mid of the month. And if this ovum gets fertilized by the sperm as a result of intercourse, then a baby is born, or else this ovum and this oocyte then gets wasted. And this is the natural phenomenon that happens every month in every woman's body until she reaches the age of menopause. So, from the age when she starts menstruating for the first time till the age when she stops menstruating, this phenomenon continues monthly without fail every month. What happens in polycystic ovaries is that the maturation and the rupture of these follicles, which should form and burst every month, is delayed or does not happen. As a result, these follicles keep collecting inside the ovary without maturing and without rupturing. What is the exact problem because of this? These follicles contain a fluid which is highly androgenic in nature. Androgenic meaning it has got a lot of male hormones, particularly the hormone testosterone. And this hormone is also required in small quantities, even in the female body, in order to maintain the natural process of reproduction and growth of the oocytes. However, in these patients, because there is no rupture of the oocyte which is happening every month, this androgenic fluid keeps getting collected inside the follicles and therefore causes a disturbance in the other hormones, which is LH and FSH. Now, coming to the question of why this occurs in the first place, most scientists have only been able to find that there is a genetic basis to this, and these genes that are responsible for polycystic ovaries are also somewhere connected to the genes that are responsible for altered glucose metabolism and diabetes. And it is in this genetic link that we find the natural cure for polycystic ovaries. And this can be based on two simple words, or rather three prongs of treatment, which is diet, exercise, and weight loss. Now, let us take these one by one. In your diet, what are you expected to do? Generally, patients who are obese, have a higher body mass index, do very well after correction of their obesity in terms of symptoms of polycystic ovaries. Just by losing weight, these patients are able to achieve a decrease, not only a decrease in weight, but their periods also come back to normal. Excessive hair growth on the body reduces. Symptoms like acne, pimples, oily skin, blackening of skin, all of these symptoms also reduce. So, when you talk about diet, it is very easy to say that one needs to lose weight, but it is rather difficult to implement. So, you can start by simple steps like in your diet, try and reduce the amount of saturated sugar. Saturated sugar is anything that we consume which gives us an instant feeling of sweetness. This is different from the natural sugar which is found in most fruits and other foods that would be available naturally. This is generally sugar which is added in tea or coffee, sugar that is obtained from cold drinks, sugar that is obtained from sweets, biscuits, cakes, and such. So try to reduce the amount of saturated sugar that you are consuming. Try to reduce the amount of outside food, particularly food that contains, as we call in Hindi, maida. And this is particularly pizzas, burgers, biscuits, cookies. All of these have a high concentration of maida. And because of this, there is usually a problem because this then gets metabolized into sugar, and the body system, particularly the insulin, has a problem in dealing with this sort of thing. So, in your diet, try to reduce the amount of saturated sugar, try to reduce the amount of maida that you consume, try and reduce the amount of course, not eliminate completely, but reduce the amount of rice that you eat, reduce the amount of potatoes in your food, particularly the fried potatoes and the chips, papads, pickles, any oily foods that will go a long way. Other than diet, you have exercise. And again, exercise is something which is very difficult to implement, but something as simple as going for a walk or a jog for 30 minutes to 45 minutes in the day, something that will at best make you perspire and increase your heart rate for 45 minutes a day is more than enough to break the cycle of uh, polycystic ovaries and to break the cycle of diabetes. So, diet, exercise, and weight loss, these three things, once they go hand in hand, the secretion of insulin stabilizes in the body. And once this insulin secretion has been stabilized, there is much better action of the other medications that are given for polycystic ovaries. So, some of the patients, by just natural treatment alone, do very well so that they do not require any medicines at all. But even if those patients who require medicines do very well with a combination of natural treatment and medicines, because then the medicines work much better, they work faster, and are required for lesser amounts of time as compared to those people who are overweight and do not follow these diet and exercise measures. If all else fails, of course, hormone treatment is available, and surgery for polycystic ovaries generally is reserved only for those very, very small amount of patients in whom diet, exercise, weight loss, and medications have absolutely no effect and are looking for a pregnancy. So I think that's all we have time for in this video. If you have any questions or comments, please leave them in the comments section below. And if you like the video, please click on the icon above to subscribe to our channel in order to keep receiving more updates. Thank you.